Hey guys! Welcome to Couple. Please like and subscribe if you like this video. The health department has quietly dipped into tens of millions of dollars to pay for the consequences of President Donald Trump's border policy, angering advocates who want the money spent on medical research, rural health programs and other priorities. The Department of Health and Human Services has burned through at least $40 million in the past 2 months for the care and reunification of migrant children separated from their families at the border, with housing costs recently estimated at about $1.5 million per day. The ballooning costs have also prompted officials to prepare to shift more than $200 million from other HHS accounts, even as the White House weighs a request for additional funding for the Department of Homeland Security, a politically explosive move almost certain to antagonize fiscal hawks in the run-up to the midterm elections. We have a public health emergency like Ebola, Zika, hurricanes, except this one is man-made, said Emily Holyabowicz, executive director of the Coalition for Health Funding, who says HHS should request emergency funding too. We should not be taking discretionary funding away from programs that need it. HHS didn't respond to questions about spending on the crisis. Frustration over the lack of transparency and the slow pace of family reunification spilled over as appropriators marked up a Labor HHS education funding bill last week. Republicans joined Democrats to unanimously back penalties for the health department if it didn't detail its efforts to reunite families. "This is not a policy we should be pursuing," said Representative Tom Cole, R. Oklahoma, the Labor HHS Education Subcommittee chairman, criticizing the administration's plan to split families at the border. "We have sent letters demanding answers with regards to the costs. And we have received no answers from OMB or from HHS," said Representative Rosa DeLauro, DCON, subcommittee ranking member. The Trump administration is withholding information from the Congress. HHS Secretary Alex Azar last week extolled his department's work to house and care for separated children, calling it one of the great acts of American generosity and charity in a CNN interview.